private healthcare in the United States is on the brink of a crisis. Doctors across the country are closing their practices at alarming rates. More and more, physicians are unable to offer the standard of care their patients have come to expect. With slashed reimbursements, unwieldy patient loads, and never-ending red tape, today's physicians face everyday challenges like never before. What does this mean for the future of our healthcare system in America? What happens when your local doctor's office is replaced by a large healthcare conglomerate? The death of the private practice would mean the end of care as we know it, and it's coming. An ongoing survey conducted over the past decade by the global consulting firm Accenture examined the employment status and practice models of 194 independent U.S. physicians. What they found surprised them. In 2005, 49% of physicians classified themselves as independent, down from 57% just 5 years earlier. By the end of 2013, these numbers had dropped to 37%. The study predicts that soon, the number will have dropped below 33% for the first time ever. That means more than 2/3 of doctors will not own their own businesses, and they will lose the right to make key decisions for themselves, their staff, and their patients. All of these decisions, so critical to patient care, will be in the hands of the insurance companies and government bureaucrats.
I've been very disappointed with what I've learned over the last 20 years in the medical field. Quite a shock to me is the corruption that we see in medicine and the big dollars that we see in medicine. And we're forgetting about the people. We're forgetting about the patients that we need to be serving.
When I was in my first year to get my doctorate in chiropractic, my mom ended up getting stage 4 cancer. It was breast cancer. They gave her about 6 months to live. It was a pretty dramatic time for us to go through. And that's when I really kind of changed the path from just chiropractic and started studying nutrition and endocrinology and hormones and understanding how do we develop these chronic diseases and these big problems and how can we go about actually fixing them in a more natural way.
As a young doctor, I was always a big fan of preventive medicine. To me, it made sense to be proactive about a person's health versus reactive. Even if we want to give comprehensive functional medicine care to our patients, it's very challenging still to do it under the insurance model.
Most private practices today operate under what is commonly referred to as a fee-for-service model. The patient is treated for a symptom or a condition, and the doctor is reimbursed by the insurance companies or the government for that treatment. The amount of time spent with a patient and the quality of care that patient receives are not taken into consideration. The doctor is paid based on how many patients they see and how many procedures they complete.
We're actually regulated on the amount of time that we can spend with our patients, and if we spend too much time with our patients, we're threatened by the insurance companies.
I'm not a diagnosing medical doctor, and so insurance doesn't cover the kind of care that I have to offer because it's not illness focused, it's health focused. So an insurance company needs an ICD-9 code to bill insurance for sickness, which has very little to do with health.
The traditional insurance model has the hands of the doctors tied.
Because the insurance companies and government officials are the ones who decide on reimbursements, physicians are often unable to get paid for wellness care, such as nutrition, exercise programs, and screenings.
The biggest struggle with the insurance model is educating patients on what should be covered and not. And so it's kind of giving them the message that if it's not covered, then don't do it. but it's not necessarily what they need for their health. In Canada, where the healthcare is actually provided for everyone, it's a problem because the government decides on what should be covered. And so the problem is that it's a system that's based on disease and not necessarily health. But health is not a lack of disease or a lack of symptoms.
Doctors and staff are working longer hours just to meet the minimums needed to keep their doors open. And sometimes it's just not enough.
There was a point actually in my practice to where I honestly didn't know if the next month I was going to be able to keep the doors open. And I remember meeting with an older friend of mine that had been very successful in life, and I actually asked to borrow some money to keep my doors open. And he pretty much made it clear that he wasn't going to help there. He was like, look, I'm not going to provide in a sinking business. When you get to that breaking point, you really feel like a complete failure. If your business is failing, you lose the ability to help people. And your mind starts thinking, well, what else am I going to do in life? And that's really defeating when you've worked so hard, gone through years of education, spent hundreds of thousands of dollars on this education, and now you're thinking, I'm about to have to just abandon it all because I can't make this work.
Who's to blame? Experts say that 75% of healthcare costs are spent treating chronic diseases that are largely preventable. In 2014, the United States spent a combined $3 trillion on healthcare. Over the next decade, it is predicted that healthcare spending will grow on average 6% per year, accounting for 1/5 of this country's GDP by the year 2025. That's over $30 trillion in wasted money, treating conditions that could be prevented. Where does all this money go?
We all know that that system is broken. The reimbursements are lower. The time that the doctor spends with patients is regulated, and we're threatened by insurance companies on how much time we spend. We're threatened with audits. And we're not allowed to take care of the patient in a good, healthy, functional level, teaching patients about nutrition, teaching patients about stress management, and all the pillars of health that we know help them to be healthy. In the clinic that I was working with, we participated in an HMO plan for seniors that was capitated. And that practice was incentivized to keep patients out of the hospital. When the patients would go to the hospital with that particular insurance, it would cost the company more money.
The insurance industry has spent billions of dollars lobbying the government to keep this money flowing in their direction, only rewarding those physicians who establish a revolving door of patients and treat them in ways that maximize profits. Doctors are working longer hours just to keep up. Patients are receiving less and less personalized care.
We had to see a certain volume of patients, and that volume of patients was typically 25 to 30 patients in an 8-hour workday.
I was running a practice that we were seeing 325 people a week. I mean, we were cranking them in and out. I mean, we were pretty high volume, and that was part of the thing is, you got to get more patients, you got to get more patients. But it seemed like the more patients I was getting, the cheaper I was having to charge, and so then it was like more people and less income. You just end up wearing yourself out.
With my patients, just making myself available really affected my family time. So if it was dinner time and I got a phone call, I would take it, I would take it because one, they needed me, and two, that was my business, so I needed to do that to take care of my family, but at the same time it was really affecting, it was affecting everything.
As an employee, I was always asked by the doctor who owned the practice to see more patients. And we were always pushed to only take one problem per patient. The patients were instructed to only tell the doctor one thing, and that we could only take care of one thing, and they would have to come back for subsequent visits to take care of the other conditions. And that just didn't sit well with me.
The country is getting sicker and spending more. The system is unsustainable. While the current system collapses under its own weight, practitioners who aren't ready to give up or give in are continuously seeking out viable options. But the question remains, how can the private practice be saved? A company in San Antonio, Texas, is exploring a unique solution to this problem: the physician as entrepreneur. Dr. Charles Webb and his colleagues at FPC have devised a comprehensive 3-year training and mentorship program that teaches frustrated doctors how to escape the fee-for-service model and establish what they call a freedom-based practice.
How do I get more? That made sense to me. I need that. I want that. How do I get more?
I started Freedom Practice Coaching in 2012, having the old concept of thinking that the doctor treats the patient or the doctor heals the patient is incorrect. We educate. And that's what really, how Freedom Practice Coaching came about, is because of that discovery and how to teach doctors how to run their practice that way. Originally, I got my undergraduate training, and then I went to chiropractic college for an additional 4 years. And that got me the fundamentals, the basis for being a doctor and moving forward. But what it didn't prepare me for is really working with the patients in a way to allow them to become empowered to take care of themselves. I was still in that thought process of, I'm the doctor, you're the patient, I'm supposed to heal you somehow. And I found out that as I was in practice, no, this is not the way it works. I stepped out of practice because I was burnt out. I stepped out because of the restrictions I had following insurance protocols. I stepped out because I was tired and fed up of having a third party determine what kind of care, what kind of service that I could provide for those who trusted me. And I believe that part of that care should be my education and teaching them how to run their life, but you couldn't code that on insurance billing. So it basically was a free service. And when your practice begins to start moving more toward an educational model, you can't make a living if it's all going to be an insurance reimbursement. And I stepped back in, not until 2005. That's when I had educated myself in this new breed of doctor, I like to call it, that practices proactive health and wellness and gets really deep into the underlying cause of us creating these disease situations. And I had a ball with it and I loved it, and for the first time, I recognized, now this is being a doctor. If you really truly believe in your truth, which is, I want to help people, that's how you do it these days. You have to get your message out and you have to be a teacher.
I discovered FPC through a friend. I was actually at a family reunion, and a friend was talking about this guy in San Antonio that was collecting like $250,000 a month and actually seeing less patients and giving patients more. And you know, at first it almost feels like, I don't know, do I buy that? But I'm like, man, it's worth a drive over to San Antonio.
I do remember the day that Dr. Sutherland called, and I remember being really excited about that conversation because we touched on all the things that I knew my practice needed, the kind of help that I knew that I needed to get my practice to be successful.
Dr. Webb discovered that today's health professionals have a very limited understanding of what it takes to run a successful practice and grow their business. He devised a simple yet effective 5-step training program to help their practices. Step 1. Get clear on your goals.
The only training that I had prior to coming to FPC with business or with practice was one class in medical school that I had, for 10 weeks. And then when I left medical school, we kind of get cut loose and it's go start your own practice. We're all passionate and wanting to change the world and we have no idea how to do it.
Prior to FPC, I was just kind of, I guess, flying by the seat of my pants. I really didn't track my business very well. I kind of knew at the end of the month, hey, I collected this much and I'm gonna take a little bit of that home, and you just didn't really have any, the goal was always just more. Once learning to track things on an ongoing basis and to set goals and to work backwards from what are my goals and how do I want to achieve those goals, it changed everything. It's like knowing the score of the game throughout the game, and I was able to change my strategies, and I was able to make adaptations and be able to do the things I needed so that I could make that business run well.
Before I started working with FPC, there were some basic numbers and statistics that I used to look at and I would track and trend. But when I started working with FPC, I actually had the opportunity to work with my coaches and look at other different types of numbers, utilization numbers, and that business knowledge and those statistics have helped me manage my practice better. That's why we're able to grow into 2 locations.
Before FPC, we would look at our numbers, I think maybe 2 times per year. Now that we're with FPC, we actually do determine goals, and it's a lot of fun because the whole team feels like they're part of the game. And with these goals that we set up and how many lives are we going to change this month, it's very empowering for the whole team to be part of that.
Step 2. Qualify your clientele.
Prior to working with FPC, I really selected my clientele based on them finding me. Really difficult cases, not necessarily easy people to work with all the time. And the thing that was most difficult, I would say, is they weren't fully committed. Because they were only paying me as needed, I would make recommendations and they wouldn't necessarily follow it. So there wasn't a lot of personal investment, a lot of personal accountability, because they knew I would just be there to pick them back up. Or they just wouldn't follow my recommendations if they didn't feel like it. And now I only work with people who are fully committed. They're fully invested if they're going to choose to work with me. So it's a whole other experience.
Step 3. Create high-quality, in-demand services.
Zymogen is a nutraceutical company, but directed only to the sales of physicians. And the reason that's so important is because many things over the counter do not have the same kind of scrutiny from the government. So you risk getting contamination from maybe things like arsenic or lead. In addition to that, there's a risk that it will not meet the claim of the label. So the label might say that you're getting 1,000 milligrams of vitamin C, and really you're getting powder or dust and a sprinkling of vitamin C. So when you work with somebody who's reputable and doing things like checking everything that you're working with, sending it to third-party labs to validate label claims, then you have a certainty that what you're using with your patient will first do no harm. Zymogen came to partner with FPC because one of the missions of FPC is to put their clinicians in touch with some of the best resources out there. So we were honored to be included in that conversation. In addition to that, they work to not only provide new skills and new tools in terms of clinical practice, but the best that are out there. And so humbly, we were grateful to accept this partnership with FPC.
Step 4. Provide an unmatched customer service experience.
In the fee-for-service model, we were extremely busy all the time, seeing patients every 15 minutes. It was very difficult to give them great care in that amount of time. In the new system, it's extremely easy to build relationships with patients and provide them good quality lifestyles and improve their health. So my day is very organized now, and we have certain times of the day where we do our report of findings. We do certain times of the days where we see new patients. So it's very easy to maintain those schedules. And we have 30-minute appointment times to an hour appointment times, and it's really great because we have good relationships with our patients now, and we can actually change their lives and give them some good hope.
Step 5. Market and brand your business.
Before FPC, I marketed my practice through the typical things, chiropractic screenings, and you go to chamber meetings and you go to this meeting and that meeting, and you do the ad in the Yellow Pages or some magazine. But again, I could not really drive the people to take action to come see me. And I even did a billboard and didn't really see a big difference from that. After going through the FPC training and learning how to market myself and actually attract patients and get patients to take action, we were able to finally open up the floodgate of people.
Before FPC, I really wasted a lot of money in marketing that was not effective. Lots of money in marketing that was completely ineffective. I spent thousands of dollars and never got a single phone call. FPC's shown me how to specifically market to the people that I'm trying to reach and what to do with them once I get them.
Through FPC, I learned about all the different types of marketing, from boots on the ground marketing to internet marketing, social media marketing, radio, newspaper, every form of marketing. And now we're at the point where we are delivering such good care and we're getting such great results for our patients that we don't have to spend a lot of money marketing. People are coming because of a word of mouth. We're getting anywhere from 160 to 200 new patients a month. So that means we're doing something right.
Armed with a new understanding of how to run a successful practice, these practitioners freed themselves from the fee-for-service treadmill. They are no longer beholden to the whims of government bureaucrats or for-profit insurance companies, and they have seen astonishing results.
After going through the FPC training, I was able to really turn my practice around. I literally was able to triple the income of the practice while reducing the number of patients that we're seeing down to less than 100 a week. But again, these patients were getting a level of service that is just unheard of out there. And I constantly have my patients tell me, this is the best value I've ever had. This was the best investment I ever made.
I've been with FPC for 6 months. The first 2 weeks, I believe it was, I earned 10 times my normal monthly revenue. To date, I've opened up a second office and hired my first employee. This past, I'd say, week, I earned as much as I earned all of last year.
2 or 3 months after we started with FPC, we actually doubled our monthly revenue. And that was a big deal for us because before that, we were actually not profitable because of all of our expenses. And so we started becoming profitable. And so that just gave us a lot of liberty to actually get more staff and make a bigger difference in our clinic.
But more than financial success, FPC has allowed them to recapture what it is that led them to the medical profession in the first place.
I have the freedom in my schedule where I take 2 mornings off a week and I get to spend time with my kids. It's allowed my wife and I to take trips and spend time together and do things that we didn't have the ability to do because we were strapped. So I have the freedom to spend a lot more time with my family, which includes obviously my mom. Because of all the change in the study, we were able to help my mom beat breast cancer. That was 16 years ago. She is vibrant and healthy and enjoys the 7 grandkids that she has now, so it's been a pretty amazing thing, but it's given me a lot of purpose. I feel like my purpose now is really just helping people see that there is another way.
The team that we have truly is a family. And the interesting thing is, even though we've grown the practice and we've doubled the size of employees, I still have the time to get to know each and every employee. I know who they are. I know their spouse's name. I know who their children are. And that's a blessing. So they truly are a family.
When I came to FPC, my husband and I had just split up. He wasn't showing up for me and the kids. I moved to Arizona. I had to start over, and I had nothing. I didn't even have a laptop. I had no office, nothing. And so when I joined FPC, it's like, I'm gonna do this. I need a kick in the butt. I need a fire under my butt, and because I need to learn. And I clearly don't know how to do this, and I'm responsible now for 2 kids by myself. So they just totally took me in, and Charlie was amazing. Dr. Webb was incredible. He was just like, we got you.
I would recommend FPC to any physician, MD, DO, naturopath, chiropractic physician who wants to practice good, sound, functional medicine and have a successful business at the same time.
I would recommend FPC for any practitioner, whatever type you are, whether you're a medical doctor or a chiropractor or a doctor of osteopath or a naturopath, whatever it is, if you feel like you have a passion to truly help people, to truly help them find the underlying cause of their problem and fix that, to truly help them gain independence in their life, but you feel like your business is holding you back. You feel like that the strain of everyday practice is keeping you from really being able to give the patients what you want to be able to give them. The FPC training is going to revolutionize your life.
I would recommend FPC to any solo practitioner that is tired of trying to figure out how to do it all by themselves, and come join us.
I would recommend this program to anybody, any practitioner of any discipline. Doesn't even have to be a physician. Anybody that is interested in wellness and in helping people, I recommend this program to everybody because it really gives you the foundation that you need to be successful, not only as a practitioner, but as an entrepreneur and a business owner.
I cannot imagine operating our business without the FPC model. It has changed how we do things so much that I would never go back to how we used to do it before.
The FPC program is definitely an investment. It's a commitment. It requires a lot of hard work, but when you commit to this, it is going to change your life.
I'm Dr. Charles Webb. I want to thank you again for taking your time to be here, and I do hope we get the opportunity to visit with you soon in San Antonio.